Hello guys, welcome to Informations Everywhere channel. Today's video is a presentation on malaria. We just want to understand the deadly parasite and its impact on global health. Let's start the presentation. In this presentation, we'll be speaking on what is malaria, signs and symptoms of malaria, how to diagnose malaria, treatment available for malaria, preventions and control measures, complications of malaria. Malaria is an illness caused by Plasmodium parasite, which are spread to people through the bite of an infected female Anopheles mosquito. Not any female Anopheles mosquito, but the mosquito which is infected by the Plasmodium. Malaria is a major threat to human health worldwide and a leading cause of illness and death in many developing countries, mostly in young children, because young children have weakened immune system. Their immune system is not strong as to an adult. Pregnant women are also more vulnerable to the illness. Also, malaria is preventable and curable. Signs and symptoms of malaria. We have fever, we have headache, we have chills, that's feeling cold. These three symptoms are common in most malaria cases. Still on the signs and symptoms, we have fatigue or loss of strength, nausea and vomiting, cough, chest and abdominal pain, feeling weak, or maybe general body pains. We have two ways of testing for malaria or how to diagnose malaria. Firstly, we'll be talking on the microscopic examination of blood. In this type of diagnostic or laboratory test, the suspected individual's blood is taken to the laboratory and is viewed under a microscope to determine which type of Plasmodium parasite is present in the suspect's blood. The other way to test or diagnose malaria is by using the RDT, that's the rapid diagnostic test, and this is commonly used in various health facilities, even at the laboratories. This just a prick of blood is taken and to determine if you are positive of malaria or not. This RDT only determines one specific type of Plasmodium, that's the Plasmodium falciparum. Treatment available for malaria. Please, before I start talking about the treatment, let's take caution of this. Malaria treatment should only be administered if a person tests positive. Malaria treatment should only be administered if a person tests positive. If your result is negative, please don't start the medication. We have the ACTs. These combination medicines are each designed to fight malaria parasite in different ways. That is the artemether lumefantrine or Coartem. Another medication is the chloroquine. This drug is preferred whenever it is likely to be effective, but many parasites are now resistant to it. So in most malaria cases, this medication will not be used. Lastly, it's artesunate. There is a tablet and intravenous medication, and most of the time the intravenous medication is used in severe malaria cases. Under the prevention and control measures, I group them into two. First, we have the vector control interventions, and secondly is the vaccination, chemopreventive therapies, and the chemoprophylaxis. On vector control interventions, this is the main approach to prevent malaria and reduce transmission. This includes sleeping under insecticide treated nets, or long-lasting insecticide net. And we also have indoor residual spraying by using insecticide. Sprays to surface where mosquitoes tend to rest or settle. Still on the vector control interventions, we also have avoid outdoor exposure at night. Mosquito tends to bite at night, so it's best to stay indoors at night. Wear clothing that minimize exposed skin. Wear insect repellent on your skin to repel all mosquitoes. Vaccination is another form of preventive measures against malaria. We have a vaccine that is used to vaccinate or immunize children from age 6 months upwards. Again, we have the chemopreventive therapies, include intermittent preventive treatment of malaria in pregnancy. Example is the sulfadoxine pyrimethamine. Chemoprophylaxis. These drugs are given to travelers before entering an area where malaria is endemic, and it's very effective when combined with the insecticide net or long-lasting insecticide net. Complications of malaria. Certain people are mostly likely to experience severe or complicated malaria. These include the following groups: young children, pregnant women, and people without any previous exposure to malaria parasites. Here are some possible complications. We have breathing issues, organ failure, brain problem, anemia, low blood sugar. Thank you for watching this presentation. Please like, comment, share, and subscribe to the channel for more videos like this. Bye.